The PN test plan changed in 2023. This happened to be the same year that the NCLEX went to the new next generation format. So let me explain the PN NCLEX test plan to you, if I can, please. I think it'll be helpful to you.
La da da, la da da la. I heard you say, just keep going, that's the way. So I get up, put my game face on each day. Lines blur between the faces that pass me by, but there's something burning I can't deny.
Hello everyone, welcome back to my channel. I'm your host and tutor, Annalise Garrison. And although I have retired from bedside nursing, I have decided not to retire from tutoring. I have been tutoring nursing students, helping them since 1997. And yes, I am still tutoring today in 2025. So I'm tutoring a whole new generation of nursing students. Now, with that generation, with the reviving of my channel, I am getting asked the question, hey, Garrison, are they changing the NCLEX for the NCLEX PN this year? And the answer is, thank goodness, no. But I think it would be helpful for you to understand what exactly is being tested and how it's being tested. So in this video, I'm going to explain the PN NCLEX test plan to you. So let's get right into it, shall we? When you first look at your test plan, it can be quite confusing because basically you have two categories. You have the content and you have the client needs. And you'll see both of these and what is the difference? Exactly how does it work? So the NCLEX, when it comes to client needs, is broken down into four categories. The first client need is safe and effective care environment. What exactly does that mean? These are questions that focus on creating a secure and efficient healthcare setting for the clients and the healthcare personnel. This includes the understanding of the principles of safety, infection control, medication administration, and managing a variety of care situations. The two contents that fall under this client need is coordination of care, which makes up 21% of the NCLEX is the content. The questions that deal with specific client needs when it comes to coordination of care deals with 18 to 24% of the NCLEX. Coordination of care means, working with others, coordinating with other people in the healthcare field to bring the client's care all together. For the RN, it's you'll see multidisciplinary team. But that's what coordinating care deals with, working with other people in the healthcare facility, specialties, all of them, to coordinate their care, to make them feel better. And then the other category, the distribution of content, deals with 13%, but 10 to 16% will ask questions specifically related to your client. and that is safety and infection control. This is the safety issue is, high risk for falls, lives alone, those kinds of things. And of course, the infection control is a whole other issue. That deals with the droplet, airborne, or contact precautions. Okay? So that is how the safe and effective client environment is broken down. Now, 10 to 24% of that of your exam will be directly dealing with the patient, client needs. So I hope I'm making myself clear. When you're studying for the NCLEX, you have to know your content and you have to know what to do for your client, right? There's actually two things the NCLEX test: content and your actions as a nurse, right? Okay. So the second category of the NCLEX test is your health promotion and maintenance. Now, health promotion and maintenance has to do with any of your questions that deal with community nursing and preventative medicine, right? Community nursing and preventative medicine. Your client needs will have 6 to 12% of your questions would deal with your actions with your client, and 9% of those questions will deal with actual content. The third category that the NCLEX PN test is your psychosocial integrity. Now, psychosocial integrity deals with the emotional, mental, and social well-being of the client. All right? Now, if we were to look at the content of this category, 12% of your questions will deal with content, and 9 to 15% of the questions in this category will deal specifically with your actions with your client. All right? So psychosocial integrity is the emotional, mental, and social well-being of your client. And the fourth main category that the NCLEX test is the physiological integrity. This is a core category that focuses on the nurse's role in maintaining the patient's physical health and well-being. It encompasses providing basic care, administering medication, reducing the risk of them getting sick again, and supporting adaptation to health changes. So, the physical content of this category is the client needs, questions that pertain to you specifically with your client, is 7 to 16%. The content of this category is broken down into 4 subcategories. So, what does physiological adaptation encompass? This is the category that most nurses have a problem with because physiological adaptation focuses on how nurses care for clients experiencing physiological changes, whether they're acute or chronic. And some of you, in fact, a lot of you, have trouble taking care of your client when changes occur. And the reason you have trouble taking care of your client when changes occur is because you are not an experienced nurse. This is why the NCLEX has changed to the clinical judgment measurement model. recognizing cues, analyzing cues. This is really, you have to understand those steps in order to change with your client, your physiological adaptation. This is why it's so very important to get tutoring. So 10% of the content will be physiological adaptation. Second subcategory is the reduction of risk potential. Whether your client comes in with a disease, an injury, or acute or chronic change, the content for this category will be at least 12%. So when there is change, what risk are they at for developing a new problem? When there is disease change, injury change, acute or chronic illness change, this will take up 12% of your exam. Again, this is difficult because you are a new nurse coming out of school. You don't have the experience. This is why you need a tutor. You understand, ladies and gentlemen? Now, obviously, some things that cause those changes, some things that cause that physiological integrity or adaptation is medication. So, now, there's no way you can know all the medications in every single categories, and you know what? There's really no way you can understand all of the suffixes and prefixes and all that good stuff. So if you get tutoring, I will definitely help you with the pharmacology of the NCLEX. But, this takes up 7 to 16% of the entire exam, but it takes up 13% of that subcategory. So physiological integrity, pharmacology will take up 13%, which is quite a bit. But it should be tested because everybody takes medication this day and age. Now, it doesn't just cover medication. Don't forget it covers herbs. It covers the self-medicating that the client is doing. It covers the knowledge about the medication. So this is quite an important category that I can certainly help you with because, like I said, it's big. There's no way you can know all the medications. You definitely have to know strategies, and I can definitely help you with those strategies. But that's the pharmacological therapy, which also include, don't forget, your TPN, your IV, your herbs, self-medicating, all kinds of stuff. Takes up 13%, the content of it. And that's it. That basically covers everything. So when we study for the NCLEX, you have to know your content and you have to know your action as a nurse. Now, to help you with the content, I have some very easy outlines that I can show you what to do, how to study for the content that you don't know. And then I will definitely help you with your actions as a nurse. Lots of strategies, lots of bullet points. But there you have it. Client needs, content. Then we have 4 categories. We have safe and effective care environment. We have client health promotion and maintenance. We have psychosocial integrity. And we have physiological integrity. And then under that, we have our subcategories, our 8 subcategories. All right, there you go. I hope this was helpful. The NCLEX PN is not changing this year. It will be changing in 2027. If it changes before that, I will definitely be on top of it and let you know. God bless, and I'll see you in the next video.
I am known by the one who calls my name, not just a number in somebody's game. You, my friend, do you feel it too?